Hello, everybody. Welcome to my channel, Eyelid Daily. My name is Dr. Eamon, and I'm an optometrist. And today we are going to learn the anatomy of the eyelid. So, I have observed that my videos are too long, so I'm going to keep this one concise. So, let's get dive into the video. So, this is the diagram of an eyelid, and you can see that we have five layers over right here. One, two, three, four, and five. Now we are going to go from the interior to the posterior layer by layer. So the first layer is going to be skin. And within the skin, we have these small hair follicles for the eyelashes. Let's just draw a diagram over here. So this is the skin portion, and we have these small hair follicles for the eyelashes, right? And into these hair follicles, we have small openings of glands, sebaceous glands of Z's or Z's, whatever you may name it. So these are the sebaceous glands of Z's or Z's, which are going to provide nourishment to the hair follicles. Near to these hair follicles, we have glands of mole, and these are basically sweat glands. Either they open into the lash follicle or they have their separate opening into the skin, right? Now, the second layer is the subcutaneous layer. Now, we all know that the subcutaneous layer is basically the dermis which attaches the skin to the muscle. And which muscle? The orbicularis oculi muscle. Now, what is this orbicularis oculi muscle? This is the muscle which helps us to close our eyelids, and this have three different portions. Now, this is the orbital part, this is the palpebral part, sorry, the tarsal part, and this right over here, which is close to the lid margin, is the ciliary part, right? So the orbital part helps to move other muscles, the neighboring muscles. The orbital part helps to stretch those muscles, right? For example, the occipital frontalis muscle, the temporal muscle, and these kind of muscles, right? Now, the tarsal muscle is the actual muscle which helps to close us the eyelids, and it also moves the eyelid medially so it can dilate the nasolacrimal duct, right? So that more tears can flow into the nasolacrimal duct. Now, this portion over here is orbital septum. Now, where does it come from? You can see this line over here. The orbital septum is actually the periosteum. Yes, you've heard me right. This is actually the periosteum which dives from the superior and to the lid margin, and this makes the gray line. You remember I've told you earlier in this previous video that we had this gray line which separates the lid from the interior portion to the posterior portion. Yes, this is the orbital septum. Now, this is the tarsal plate. And in this tarsal plate, we have these tarsal glands. So what are these tarsal glands doing? They are producing sebum. These are also called the meibomian glands. So what this meibum is going to do, this is the outermost layer of the tear film, which will prevent the tears from evaporating. We know that we have three layers of the tears. We have outer oily layer, inner aqueous layer, and the innermost mucin layer, right? So these are the tarsal glands, and you can see these vertical yellow lines when you invert the eyelid, right? Now, what are these muscle fibers? These are originating from this posterior surface and going into the interior. This is the LPS muscle. What its abbreviation is levator palpebral superioris. Now, again, sorry for my pronunciation if I'm making a mistake. Now, in the LPS muscle, we have two subdivisions. One division is the tarsal muscle, which attaches to the tarsal plate, and the second one is the voluntary muscle, which will pierce the orbital septum, and its fibers will attach to the interior surface and to the skin. And you may have remembered that I have told you that we have this superior palpebral sulcus, which is due to the aponeurotic fibers of the LPS, and this sulcus is formed due to this. So this is the reason the fibers will get into the interior surface and into the skin, and they will make the superior palpebral sulcus. And why do they do this? Because these muscles are responsible for the sympathetic innervation of the tarsal plate, right? They are also responsible for opening of the eyelid, right? And these muscles are innervated by the third cranial nerve, which is the oculomotor nerve. Now, what is this layer? You may not count this layer into the eyelid, but it because it adheres to its posterior surface, that's why we count it as a sixth layer. So this is the conjunctiva. And being more precise, this is the palpebral conjunctiva, which adheres to the posterior surface of the eyelid, right? And in this posterior surface, we have at this margin, we have at this inner surface, most inner surface, we have two glands, which are the accessory lacrimal glands, the glands of Krauss and Wolfram. Now, these accessory lacrimal glands are the ones which are producing the aqueous layer of the tear film. Yes, then you may have this question in your mind that what is this lacrimal gland doing? Actually, lacrimal gland only has the sympathetic innervation. Even if it does have its parasympathetic innervation, it is not quite clear yet. So this lacrimal gland is only responsible for the reflex steering, right? And these two glands, Krauss and Wolfram, are responsible for the aqueous layer of the tear film. So these two glands are present in the fornix of the conjunctiva. We have three types of conjunctiva: the palpebral conjunctiva, the fornical conjunctiva, and the bulbar conjunctiva, which comes onto the globe, on the or eyeball, right? Now, now it's a mess right here. Let me clear this. What is this? This is the orbital fat. Now, this anterior surface is the periosteum, and this posterior one is the orbital fascia, which is also formed by the periosteum. But you know that the periosteum, which covers the orbit, is called the orbital fascia, right? Now, now let's talk about the nerve innervation. So we have two muscles. One is orbicularis oculi, and the other one is LPS, right? The orbicularis oculi helps to close the eyelids, and so it is innervated by the seventh cranial nerve, which is the facial nerve, the zygomatic and temporal branches of facial nerve innervates the orbicularis oculi muscle, and the LPS muscle is divided into the tarsal muscle and the voluntary muscle. So I've told you earlier that the tarsal muscle is innervated by the sympathetic fibers of the cervical ganglion, and the voluntary muscle is innervated by the third oculomotor nerve and its superior branch, the oculomotor nerve, right? Now let's talk about the blood supply. So the blood supply of the eyelid is very simple, right? So we have this marginal arterial arc right over here, and we have this peripheral arterial arc right over here. And how is this arterial arc being formed? So the medial end is formed by the medial palpebral artery, and the lateral margin ends are being formed by the lacrimal artery, and the zygomatic branches of these arteries. So, and a little bit, and on the inferior peripheral arc is also being formed by a lesser portion of the infraorbital artery. The lateral side of the lymphatic vessels will drain into the superficial parotid lymph nodes, and the medial side of the lymphatic vessels will drain into the mandibular lymph nodes, submandibular lymph nodes. So this was the anatomy of the eyelid. I have told you everything about the innervation, the vascular system, and the layers of the eyelids. So there are more videos coming up in the future. Till then, like and subscribe, and I hope you like my videos.